Bismillahirrahmanirrahim. Today I am going to tell you a few important Ospe on the lower limb, and it applies on the all disciplines. Session number 1 can come to you for the radiology. It can be hip joint, and markings on the head, neck and shaft of the bone can be given to you. On the knee joint, marking of the condyles can be given to you. Marking of the femur, tibia, fibula parts like medial condyle, lateral condyle, intercondylar eminence, and the head, neck, and shaft of the bones can be given to you. On the hip joint, on the hip joint, I was talking about the femur bone, that femur tip on the head, neck, and the greater trochanter, lesser trochanter. And on when we talk about the hip joint radiology, so the ischium, ilium, ischium pubis, superior ramus, inferior ramus, pubic symphysis, and ischial tuberosity, and intertrochanteric line if it is marked. And these are the few important points on the radiology. Tarsal bones can be marked, in which you can see my radiology spot, radiology video regarding to pass your radiology spot, in which on the tarsal bone, the cuboid, trapeze, metatarsal, phalanges, cuneiforms, calcaneum, talus, and foot of the radiology of the foot is also present over there. On the station 2 thigh and leg model, I have already posted a video of that on my channel. You can see that video. For station 3, greater sciatic foramen can be marked to you, and it is basically from the osteology point of view. Identify the marked structure and illicit boundaries. Boundaries are anterolateral is greater sciatic notch, posterior medial is sacrotuberous ligament, inferiorly sacrospinous ligament, and distal spine. Main contents are by the greater sciatic foramen, piriformis muscle, sciatic nerve, superior and inferior gluteal vessel nerves, pudendal nerve, internal pudendal artery vessels, posterior femoral cutaneous nerve. Lesser sciatic foramen boundaries are anteriorly body of ischium and ischial tuberosity, superiorly ischial spine and sacrospinous ligament, and posteriorly sacrotuberous ligament. Contents are tendon of obturator internus, nerve to obturator internus, internal pudendal artery and vein, and pudendal nerve. Obturator foramen, which structure passes through the marked structure on the given bone, obturator nerve and vessels. Now comes to the station 4, that is on the ligaments. Ligaments can be asked to you. Ligaments of the knee joint, name the intracapsular and extracapsular ligaments of the mark joint. Intracapsular ligament are anterior cruciate ligament, posterior cruciate ligament. Extracapsular ligaments are patellar ligament, oblique popliteal ligament, arcuate popliteal ligament, tibial collateral ligament, fibular collateral ligament. Ligaments of hip joint, when you talk about a mark can be given to you on the hip joint. So you and the second question can be asked to you, please write down any 4 ligaments on the hip joint or either on the knee joint can be asked to you in such a way. Name the ligaments of the mark joint, that is the hip joint, is the capsular ligament, iliofemoral ligament, pubofemoral ligament, ischiofibular ligament, and ligament of teres, ligament of head of femur or ligamentum teres, also known as learn to learn the hip joint ligament. You can easily learn it. Write down femoral in front of each bony part of the hip joint, that is ilium, ischium and pubis. So the iliofemoral, ischio-femoral and pubofemoral. Please do not forget to write down the ligaments of the hip bone. Popliteal fossa can be given to you, and boundaries can be asked to you. Superior lateral boundaries formed by the bicep femoris muscle, superior medial boundaries formed by the semimembranosus, semitendinosus, inferior lateral boundaries formed by the lateral head of gastrocnemius and plantaris muscle, inferior medial boundaries formed by the medial head of gastrocnemius. Roof is by the skin, superficial and deep fascia. Floor is by the popliteal surface of femur, capsule of knee and popliteus muscle. Femoral triangle boundaries can be asked to you. Superiorly based by inguinal ligament, medial by adductor longus, lateral by sartorius, floor by iliopsoas, roof by fascia lata. Skin contents are lateral to medial are femoral nerve, artery and vein. Nerve, artery and vein. Navel, basically E is for canal, and deep inguinal ligaments. Okay, E is for deep inguinal ligaments. Okay. Now let's talk about the muscle attachment. Of bony mark can be given on the either on the X-ray or on the bone. Greater trochanter, a mark can be given to you on the greater trochanter, and the muscle attachment can be asked to you. I am going to make a separate video for that.